Thanks so much for joining us today. I'm Cody Holyoke. Progress is being made in the fight against the pandemic. As new coronavirus case numbers drop across the country, we are starting to see other states roll back health and safety restrictions. New York's strict statewide indoor mask mandate ended Thursday for people outside New York City. California's ends for vaccinated people this coming Tuesday, and leaders in Massachusetts plan to lift a statewide mask mandate at the end of this month. These are just a few examples, and these changes are being made while the CDC recommends people keep wearing masks.
Right now, our CDC guidance has not changed. We have and continue to recommend masking in areas of high and substantial transmission. That is essentially everywhere in the country in public indoor settings. We continue to recommend universal masking in our schools.
That's CDC Director Dr. Rochelle Walensky. She's quick to point out while case numbers are dropping, new infections and hospitalizations are still higher than other surges we've seen in the U.S. Keep in mind, the states we just mentioned rolling back these restrictions, New York, California, Massachusetts, they have full vaccination rates in the 70s, leaps and bounds above what we're seeing in Kansas and Missouri. Take a look. We're just over the 50% mark, according to state health officials in both our states. And remember, this is a problem that affects all age groups, especially right now. It's why school districts are now holding vaccination events to get kids ages 5 to 11 their coronavirus vaccines. Kansas City, Kansas Public Schools joined forces with county healthcare workers Thursday at a middle school to try and boost the numbers to keep kids and their families safe.
So I think that families, as they're learning more about the vaccine and they're getting it, it's just making our community stronger, and we're stronger when we're together and we're doing this together.
Now, locally, a little more than 25% of kids ages 5 to 11 are considered fully vaccinated, according to numbers from the Mid-America Regional Council. 1 in 4. And many counties are much lower. Ray County, for example, is below 8%. These numbers are surprisingly low when you consider these vaccines have been available to this age group for months. So what's behind the hesitation? Joining me now to get to the heart of the matter, Dr. Stephen Lauer and Kevin Alt from the University of Kansas Health System. Dr. Lauer's a pediatrician, Dr. Alt's an OBGYN, and a member of the CDC panel that helps with the vaccine approval process. So, gentlemen, first off, thank you both for being here. First off, Dr. Lauer, what are you hearing from parents of these kids who are potentially hesitant? We're seeing a lot of hesitancy right now about getting a vaccine.
Well, what we're seeing, I think, is a lot of the parents of the younger kids are just concerned about vaccinating. They hear a lot. There's still a lot of misinformation out there. And I think what we're hearing is they're saying, well, they still think their kid may not get that sick even if they get COVID. Maybe they won't spread it. Is it really safe to do? And so all those things coming together, just even more so than the older kids worried about getting the vaccine into their kids, even though it's the best thing for them.
Sure, and we have heard this for almost 2 years now, right? Oh, if kids get it, they're going to be okay, but that's not necessarily the case.
Well, they're okay until they're not,
right.
I think would be the answer. You know, if you're unlucky enough to get sick and to get very ill, that's a very hard thing to deal with. It's I usually compare it to getting hit by lightning. You know, you don't get hit by lightning very often, but when you do, there's terrible consequences.
Sure. And so how do you walk parents through some of the misinformation and try to debunk some of these myths that are here?
Well, one, as we've learned more about it, this particular variant is having a much greater effect on younger kids. The total numbers are small, but the percentages are definitely up. This affects younger kids more. Two, they can spread it. And we're seeing this much more now as we're more open. Kids are out in daycares and in schools. They're actually bringing it home now and spreading it, which was not the case earlier on when everybody was better quarantined. And then lastly is just the overall question of we have to get out of this pandemic eventually, and the only way we do that is to get enough people long-term resistant to the infections. That's vaccination of as much of the population as we can get to.
Sure. And Dr. Alt, on the panel that you sit on, I mean, there have been many strides of the last nearly 2 years trying to get these vaccines out to the people and to the kids. Is access still a problem for children?
Access is probably not a problem. You know, we talked about that before there were ever vaccines available, is the good news there. And so there was a plan on how to get them distributed even before we knew what the vaccines were.
All right. And any other major concerns right now when it comes to these parents? Because obviously, I mean, as an adult, you take your risk, you know your risk, right. But you have an entire life of a child to consider, which sure. I get it. It's a major decision that you have to make.
Absolutely. And, you know, parents are just being careful and doing their due diligence as they should. But again, as there's more and more information available every day, it's clear that these vaccines are safe, effective. They're getting better data about younger kids now, and we're hoping that'll be out soon, but these are safe, effective, and much safer than getting the actual infection.
We get a lot of questions from viewers. I can only imagine as healthcare professionals, you are inundated with questions. How do you walk your patients through this and try to show them, look, the data says these are safe?
Well, you know, most of my patients are worried about pregnancy and
Right.
COVID, and we have a lot of data now. The news is very bad. COVID can be very bad when you're pregnant, but we have a lot of data about pregnancy. You know, there are studies with tens of thousands of pregnant women in them that we can look at, and overall the safety profile for pregnant women looks very good. And so we're encouraging that group of people to get vaccinated too. That's one of the 17 or 18 risk factors for severe disease that we talk about.
All right. Dr. Lauer, you know, I know quite a few parents whose kids have caught the virus in the last month and a half or so. I mean, there's been this huge surge since the start of the new year. Some are still pushing ahead with plans to get their kids vaccinated. Others are saying, you know what, they've had it, let's hold off for a while. What do you recommend parents do in that case?
Well, again, this all is evolving and new information all the time, but natural immunity seems to wane over time with this particular virus, which it does for many of the natural coronaviruses. The long-term way out of this is the longest, resistance to disease possible, which does come with vaccination. So the wait is, what are we waiting for? We're going to wait for the next variant to come around and then decide what to do, or do we just protect your child for as long as you possibly can, which remains with these safe, effective vaccines.
Right, still a lot of questions, but the data is showing that these vaccines are safe and effective, and I think that's important to convey, for sure.
Correct. That is the message that just has to be out there in the face of all either legitimate concerns or just misinformation that's out there, that these are safe, effective, and much safer than getting infected overall.
All right, well, I appreciate it. Doctors
Our
Lauer
pleasure.
and all, thank you so much for your time today.
Thank you.
Thank you.